African Americans are in a crisis, impacting emotional and mental health of both youth and adults. There's historical dehumanization, oppression, violence against African American people, contributing to a myriad of disparities.
This includes inadequate access to care in the health system and the inability to process and deal with layers of individual trauma on top of new mass traumas from this COVID-19 pandemic, as well as police brutality. According to a study done by the CDC, the suicide rate of black males ages 15 to 24 years old rose by 47% between 2013 and 2019, and by 59% for black females of the same age. Here to discuss her personal experience with suicide is BNC political contributor Ameshia Cross. Ameshia, this is a very difficult thing to discuss, and yet it's happened to you personally. Can you share with us your personal experience from losing a loved one due to suicide?
Absolutely, and thank you for elevating this conversation. I think that we just don't talk about it enough in the Black community. First off, my younger brother committed suicide when he was 12. What we know today is that over 71% of young people in the Black community, when we're talking about suicide, 71% is the increase in the rate of suicide over the past decade for children. I know that when we started off, we started talking about the stats for adults, but we're also looking at this astronomical rise in children. And then just this past weekend, my cousin, who happened to be an Illinois state trooper, committed suicide on the highway in Chicago. And it's still very fresh for me. It's very fresh for my family. I've spent the entire weekend pretty much crying on my living room floor, wondering, one, when somebody passes from suicide, you always wonder what you could have done to stop it, any signs that you missed, why this is happening. It just hurts so bad because everyone takes it differently. But I think that in the Black community, when we talk about suicide, there's such a push and a shunning and a silencing around it. And people are still in disbelief. Even in my own family, after the reports came through, after the investigation was done for my cousin, we still have people who just do not want to believe that this could happen, that suicide was real, and that is actually what happened. And it makes it harder to accept, but it also speaks to, I think, something bigger in the Black community around just a push against acknowledging that suicide happens in our families.
Ameshia, I know that this is a challenging moment for you, and so helpful for us to have your voice carry through about what it is that people in the community are facing. What is the stigma? What is the struggle with mental health in this moment?
That's a great question, Nayyera, and I honestly believe that it is the fact that as African Americans, we have always been taught that we are supposed to be strong. We are supposed to face whatever comes our way. Our ancestors did it in shackles. They made a way. Black women have been carrying the world on their backs for the longest. We're supposed to just get up and keep going. Black men are supposed to be alpha males. They're not supposed to cry. They're not supposed to show emotion. They're supposed to man up at every given cost and every single time, just be stronger. I think that all of that, all of those heroism terms and stories that we've heard over the years have actually failed us in many ways because we don't really acknowledge our pain. With that being said, we also don't have enough mental health supports in our communities. Our children don't have the counselors in their schools. Adults don't have the funding in terms of health insurance that covers a lot of the mental health resources that we tell people to go to. If you're telling folks that they need to find a counselor, guess what? Those cost money. And the majority of our people are not covered by insurance that would actually be able to take care of the cost of treatment as it results or relates to having conversations with counselors. As somebody who has most recently, I've dealt with losing my mom, I've dealt with losing my grandparents, I also dealt with losing my brother to suicide, and now my cousin. I just got a counselor myself this year. It took a lot to finally reach the point where I felt like now is the time that I need that. I probably needed it years ago, but I felt that it was my duty to just keep on going, to keep smiling, to get up every morning and work hard, and that was going to be enough. And I think that you reach a point where you understand that it is not. When the voices, when everybody around you is, you're tired of putting on that front. You're tired of, having to get up every morning and basically show a face to the world, even though you're really, really hurting inside. And I think that for our community, there has to be more support for individuals who need that type of help. It doesn't mean that you're crazy. It doesn't mean that you're falling apart or that you're not strong. We have strong people every day who seek and need that level of attention and support.
Ameshia, the important thing you said is that you have to have support. And if the support systems are not there because of professional mental health experts being in the area, and then if they are, you can't afford it. So in that regard, how do families, as well as the broader community in that area, reach out to each other, neighbor to neighbor, family to family, and even through church and mosque to really reach out and touch someone's life to make sure that they're asking them, are you okay? And if they're not seeing those warning signs, looking back through the past, what can they do about the present in order to save that person for the future?
Don't let mental illness or mental health be something that is stigmatized. It's not only stigmatized outside of families, it is stigmatized in the families themselves. As someone who has come from a generation of Black people, my mom was bipolar, my brother committed suicide. I have cousins who also have mental health issues. And at the end of the day, the majority of them went without any type of treatment at all. It is very important and vital that within our own communities, in our own households, we talk about this. We don't shed shame, we don't stigmatized, we talk about it, and we make sure that we are finding those resources. I'm a native of the city of Chicago. When Rahm Emanuel was mayor, he shut down mental health clinics across the south and west sides. Those are largely African American areas. It was very depressing to watch that happen as a resident. And I think that we have to continue to fight. We have to continue to petition the state, whatever state we live in, to ensure that those resources are available, and not just in wealthy areas that don't look like you or I, but in areas where we need them the most, which are often areas that are impoverished, which are often areas that face violence at endemic levels, which are often areas where young people have absolutely no place else to turn. They need the most help.
Ameshia Cross, BNC political contributor, glad to have you as part of our team, and thank you for sharing your personal story with us tonight. Really helpful.